Limpopo has recorded more than 400 cases as well as 2 deaths from malaria so far this year, causing alarm among health officials. Joining us now to discuss the extent of the disease and the strategies to control it is Limpopo Health MEC, Dr. Phophi Ramathuba. MEC, a pleasure to have you on the program this afternoon. Firstly, talk us through the concerns raised by your department about this resurgence of malaria in some parts of the province. 400 cases and at least 2 deaths having been recorded so far.
Afternoon, Translate, afternoon to all your viewers, and thank you very much for inviting us. What we can indicate as a province is that since the malaria season began, around October, we only registered around 200 cases. Yeah. But the past 2 weeks, we doubled the number to 406, and that has been a concern for us. What we when we try to analyze what could have been the cause, there's a possibility that we might be worried about the alarm or the resurgence, while actually it is our efforts, because 2 weeks back we launched a program of active malaria surveillance, where not only this year are we focusing on indoor residual spray, but we trained our community healthcare workers to move from one household to another to do rapid tests for malaria. Actually, we are finding cases ourselves. And secondly, we are saying our EHP, we've trained some of those, they are now qualified to initiate treatment, oral treatment, to can prescribe the 3-day dosage of Coartem. But thirdly and finally, we also are following on the COVID-19 strategies of contact tracing. If you test positive for malaria, what we usually do, we'll send a team to your household to go and test everyone in that household. So there's a possibility that we are finding cases ourselves, which is a good news for us. Because why am I saying this? Is that unlike in previous years where you will have many hospital admissions, this year we are only having positive cases that do not warrant admissions. And even the death, you can see it's only 2 cases. But in the previous years, by this time we would have registered many deaths, because we pick up the cases late. Even the 2 cases, unfortunately, is those that presented late in our facilities, and we think we could have saved them had they presented earlier.
As you continue with your efforts to track and trace cases of malaria, speak to us about the hardest hit districts in the province.
I beg your pardon?
I'm saying if you may just take us through the hardest hit districts in the province. There's mention here of Vembe, Mopani as well as Sekhukhune being amongst the hardest hit.
Yes. The hardest district is not Sekhukhune. Vembe district is known to be a malaria endemic area. If you go to areas of Musina, that side around Madimbo area, moving to Thulamela municipality, part of Collins Chaban, and a few parts of Makado. Currently we have registered 194 cases. And also the second district is Mopani. If you go to your Kruger National Park, your Phalaborwa, your Greater Tzaneen, Greater Giyani municipality, those are also the second hardest hit at 184 cases. Now when you go to Sekhukhune, it's only 8 cases, and Waterberg and Capricorn also, they are not malaria endemic area. And these areas which have registered 10 and 8 cases, when we trace such cases, this is what we call traveler's mosquito, is that you come and visit Vembe. Sekhukhune, for instance, is a mining area. The cases that we have picked up are people who are linked to those who reside. Some of them are coming from as far as Mozambique, some are coming from as far as Vembe or Mopani, and then they travel to go to work, and in their paper bag, in their taxis, they travel with these mosquitoes, because it's only the Anopheles mosquito that is able to infect and transmit malaria. Not every mosquito has got the capacity to can transmit malaria. So these 2 districts are the ones that we have already started with indoor residual spraying, talking to people out there, and active surveillance. But the Waterberg also, we are looking at the Lephalale area where we are bordering with Botswana, because that's where we have seen 10 cases around that area. So even in that area, we were there this week. we're doing a lot of active surveillance and also indoor residual spraying. But what is important to your viewers out there is that we are facing December festive season this year, hoping that many of you will be vaccinated and we won't go into lockdown. We are welcoming visitors to Limpopo. So as you will be thinking of visiting any parts of Limpopo, try to check in the map if it's a malaria endemic area. If you're going to Kruger National Park, visit your doctor before you leave so that they can give you a prophylaxis for malaria. When you arrive in the destination, please try to make sure that you have got your mosquito repellent, your room, if it's got an aircon or a fan, they do assist with malaria. But what is important is that when you go back home and you start to have fever, like headache, or COVID-19 symptoms, because your physicians in Gauteng are not used to treating malaria, every fever like, they will, of course, the first suspect is COVID. So try to explain to them that I've been to an area that is a malaria area. Then they will be able to test for malaria. Because in Limpopo, every case that presents with COVID-like symptoms for flu-like or meningitis, we also test for malaria. That is why we're having many cases that were picked up and we pick them up early. Lastly, just remember, we can prevent malaria and also we can treat malaria, but also malaria can kill you.
And speaking about COVID-19, of course, our chat comes as the Vuma vaccination drive is in full swing in various parts of the country. Speak to us about your own province's campaign and around the vaccination drive as well. Are you seeing more people taking up the vaccine?
I think I need to be honest, we were concerned after during the elections period because of our voting and vaccinate campaign. We saw a large number of people coming in for being vaccinated. Even on election day, we saw a large number of people, parents bringing their children who are 12 to 17 also, the whole family coming in to be vaccinated. But immediately after elections, we saw the numbers going down, and we've seen it's a trend countrywide. And we think people were worried during elections that when you're having all these rallies, you might trigger the fourth wave. Now, after the elections, a week passed by, they don't see a fourth wave. They said, they relaxed. That is why this Vuma campaign is very critical. As I'm speaking now, I was just in one of the churches, one of the biggest churches around the Mokopane area, wherein the pastors have also partnered with us so that we can vaccinate the congregants, because we want to see our churches not closing this December. We want to have all-night prayers like we used to do in the past, and we can achieve that if all of us can commit ourselves and take up this vaccine. While it's not mandatory at the given point in time, but we must just remember that by getting as many of us being vaccinated, we can be able to have our normal festive season. We don't want to think about last year's 28th December, if you remember the family meeting on the 28th of December, closing the country. That was very painful for many of us. We don't want to see that, and we can achieve that by taking up this vaccine.
Also concerning is this apparent reluctance by men to get their COVID-19 shots. I mean, problems have been experienced in parts of the country, including the Eastern Cape. Speak to us about the Limpopo experience. Are you finding that men are quite reluctant to go and get the jab?
There are areas, for instance, we were struggling with Skukune area about men getting vaccinated. That's why we now started to partner with our traditional leaders. For instance, our Saturday was dedicated to a traditional leader, the senior traditional leaders. They're the ones who were assisting us to say, who were even vaccinating at the traditional council, so that if the leaders themselves can be able to talk to men, because we think it's best for men themselves to talk to each other, because there are several myths. I think the biggest myth is this thing that you will suffer from. I think most of them are worried about their sexual dysfunctionality should they get vaccinated. So we are getting men themselves to speak about this, to say we have been vaccinated, but nothing is happening. And what is interesting in our province is that women themselves are coming up to say our men have been vaccinated and we don't see any change in the bedroom. Actually, some of them are even saying we have seen better or improved performance, whether it's psychologically or it's not. But the reality of the matter is that is a myth, the fact that your sexual functionality will be diminished because of the vaccine. That is not scientific proven. It's just one of those fake news that is scaring you from getting vaccinated. We're vaccinated many men. The other issue was saying you are going to be impotent. You won't be able to, as a woman, you won't conceive. But we want to reassure you that there are many health workers whom we vaccinated in February when we started in March. They are currently now pregnant. Those nurses are the ones who are coming to say, look, I've been vaccinated and here am I pregnant. So we need those positive stories of people who will be telling the truth, so that because we are competing for the space with those who are anti-vaccines. When they know that they are failing in their campaign, they manufacture stories that don't exist. So it is best for people themselves to talk about it, not us as politicians, because people do not necessarily believe much or trust politicians, but they trust their own community leaders.
Now, MEC, as we wrap up our discussion, there's also been a concern over the prospects of a fourth wave of infections and just the possible impact it could have on sectors like the tourism sector as well. Limpopo is known as a high-dense, if I may say, a tourist destination where oftentimes, even during the festive season, we'd see many more people making their way to the province. Speak to us about your preparations in this regard.
I think you're quite right. Key economic drivers in Limpopo, it's your mining, your tourism and agriculture. And our tourism, we know it has been hard hit. Last year we didn't do well because of COVID-19 and the hard lockdown that we found ourselves in. We are currently in the process of recovery. The MEC for Economic Development and Tourism has been working with us. We have even partnered with lodges where we will go and vaccinate their staff in those lodges. And right now what we're doing is that we're doing the malaria campaign. We are spraying in our lodges at the same time, also vaccinating all the staff members. And because we know that if we really do not allow the economy to open the tourism industry, as a province, we will continue to find ourselves in difficulties. So to all those who want to visit Limpopo, one thing that we can reassure you is that as it is for now, Limpopo, we are registering the lowest number of COVID-19 cases. There are days where in the past 24 hours, you will register 0 or less than 10. So that is a very good and a positive sign. But this celebration and excitement can be short-lived if we do not continue with the vaccination, because whether we like it or not, the fact that many people in Limpopo, especially the adult population, who have already vaccinated more than 41% of those, it's contributing towards the low infection rate, because when you are vaccinated, we have seen it with our healthcare workers. So we are saying to those who want to visit, the safest place that you can visit is Limpopo. You will enjoy your tourism. You know you are safe. We comply with COVID-19 and we are vaccinating. And you yourself, go get vaccinated and come and visit Limpopo. We don't expect the country to close this time around. Someone was asking me, are you ready with your ICU beds, with your ventilators, with your nurses? I can respond to you by saying our nurses are tired, we are fatigued. We've been dealing with COVID-19 for almost 2 years now. But currently, there is a vaccine. There is no need for us to go through the third and the second wave experience. Go get vaccinated. If many of us get vaccinated, we might avert that fourth wave. And that's the state of readiness that I can share with South Africans. Vaccinate, vaccinate, and vaccinate.
Well, you've heard it from the lady herself. That's the MEC for Health in Limpopo, Dr. Phophi Ramathuba, speaking to us about the resurgence of malaria cases in the province and also her administration's response to the COVID-19 pandemic as we do brace for a possible fourth wave of infections.